Something I keep seeing pop up in the news is people getting caught for practicing medicine without a license in terms of med spas. There are unlicensed random people who are performing injections and causing harm, getting caught, getting arrested, and going to jail. So I think this is a multifaceted problem because there are multiple people involved in why this is happening. A lot of these people who are unlicensed providers believe that they are in the right to inject because laws differ from state to state. And in some states, the laws are clearly black and white. And in other states, laws are what we call a gray area. And that's very misleading. And oftentimes people actually end up going to a place where they have no idea what the laws are. So they just kind of show up to a place. They don't know that only a doctor or only a nurse practitioner or a physician assistant or a nurse can inject them. So they're just assuming that they're in a place that they can trust. The problem lies in multiple different areas. One, the actual patient. So do you know where you're going? In the aesthetic space, you should probably, as a patient, go to someone who is at least an RN or a nurse practitioner or a physician assistant or a doctor. And then there's the unlicensed individuals who are performing these medical treatments that they should not be performing. These people think that they're justified and it's in their right to be doing these treatments. And this is because certain states do not actually make it clear as to who can and cannot inject certain things like Botox. So you get like a random person injecting Botox in one of their rooms because they think that because they took a course or because they learned it on YouTube that they can all of a sudden inject Botox. In every state, it is clearly black and white. But the reason why like some of these things are like a gray area is because they're not regulated enough. They're not enforced. These laws are not enforced by government officials. They wait for that bad thing to happen in order for that to trigger a complaint to the medical board, and then that medical board investigates, and then they find out that this person was an unlicensed provider, and then like all hell breaks loose, right? They need to make things clear state by state. Somebody might actually get hurt. And what, like, do you all know like what happens to a lot of these people who are practicing without a license? They don't really have anything to lose. For actual like health professionals in this field, when they mess up, they have everything to lose. Make sure you know the laws of your state and how it pertains to your license and what we call the business professions codes, because you may be violating a ton of them and not even know it. So for those of you who are patients, just be mindful of where you're going, do your research on the provider that you're going to, make sure they actually have a license in their state and that they're practicing within their scope. And then for the actual like people who are trying to be the provider, make sure you have a license or else you are probably breaking the law. And just remember that if you do get caught, ignorance does not buy you innocence.